Okay, so this is chapter 2 lecture on the healthcare team and medical environment. We started the presentation with an introduction that's listed on screen 2. And then we talked about choosing healthcare management as a profession. Okay, so now we're talking about types of medical practice ownership. So the sole proprietorship is what? It is one person. You can gather that from the information that it says sole. Sole is one, right? Do you understand? That means nobody else is responsible except for that one person. An example of this would be a physician's office where it's just the physician and his or her employees. And in that office, he's not owned by anybody else. So it's not an Ohio Health physician. It's not an Avita physician. It's just a doctor by themselves. These are oftentimes dentist offices. So a lot of times you'll see like Dr. Dove Dental. That dental office is only Dr. Dove's. No one else works there, and that dentist office is not controlled by any other corporation. Does everyone understand what a sole proprietorship is? Okay. General partnership or group practice. Physicians are partnered to share in expenses of running the practice. These physicians share liability risk. So like we talked about, if it's Dr. Dove and Dr. Smith and Dr. Dove accidentally kills somebody, Dr. Dove and Dr. Smith are both responsible. Does that make sense? Okay. Now, limited liability means that you have Dr. Dove and Dr. Smith, they work together. Okay. They share all the costs financially. But if something happens that Dr. Dove kills that patient, Dr. Smith is not as liable as Dr. Dove is, okay? They kind of have their own liability insurance, their own protection. They take care of themselves as opposed to the office taking care of them as a unit. The professional corporation, again, Ohio Health or Avita, those are your professional corporations around here. I believe in Willard, it's Mercy. Mercy is a professional corporation. Ashland has like what's the hospital up there is called? Huh? I can't hear you. Samaritan, thank you. Yeah, Samaritan is the corporation, etc. And then there's your clinics. How many of you have been to an urgent care? Just raise your hand. Yep, that's a clinic. That's something that an MA could work at. But in these clinics, they're usually either A, owned by those professional corporations, or they're B, standalone clinics. I know in Mansfield, over there off of, I can't remember what the road is. There's an urgent care. Oh, you know the old White Castle? There's an urgent care right there. That's a privately owned urgent care. That would fall under a retail clinic, okay? I don't know where Ashland Road is, but probably, maybe. Oh, cool. Okay. Yeah. Now, the one on 4th Street, that's the Ohio Health, that's a professional corporation, so that's not a retail clinic, okay? Does that make sense? If it's owned by a hospital, it's not retail. If it's privately owned by the physician or maybe the physician and another person, then it would be a retail clinic. All right, primary care practices. So, services provided are primary in nature. Does anybody have an example of a primary practice service? To give you a hint, there's a few listed on the board. Yes. Physical exams. We're going to learn how to examine patients this year. What about giving them vaccinations? Okay. What about small surgical procedures? Like maybe they have a cystic acne on their face and you work for a dermatologist, and then in that case you would be removing the cystic acne. If it's at a primary doctor's office, sometimes it's skin tag removal or physical exams for like sports, or maybe you have an illness that requires not immediate attention, but somewhat immediate attention. You would go to your primary care. These are your family doctors, okay? These are the people that are the doctors that you go to for your basic needs. And then if you need something specific, you get sent to a specialist, okay? All right. Types of physicians. So I have attached on Google Classroom a handout of the different types of physicians. I'm not going to go through and read each one to you, but please be aware that you do need to be mindful of what types of physicians there are And the best way to be aware of that is to read that handout, okay? All right, where's my mouse? There it is. Any questions so far? I know I'm giving you a lot of information, so if you have questions, please just feel free to raise your hand and let me know. Some physicians are located mainly in the hospital setting and others are located in an ambulatory setting. Ambulatory means outpatient. It means that you work outpatient. So your family doctor or your pediatrician, which some of you might use pediatricians or family doctors depending on your parents' preference. Some of you might see your doctors in a hospital building because that's where their office is located, or you might see them on a different road completely disassociated from your hospital setting. If you can walk in and walk out that same day, it's an ambulatory service, meaning it's outpatient, okay? The term outpatient is really important to understand. Like, I can't specify it enough. Outpatient versus inpatient, okay? These are two things that you need to be conscientious of. Outpatient means you walk in, you walk out same day. Inpatient means what? What?
You go in and you stay.
You're staying the night, right? So you go in that morning and you don't get to leave until they discharge you over 24 hours later. Okay? All right, so the hospital setting, there are physicians typically located in the hospital setting. There's emergency physicians. If you've been to the emergency room, you've seen one of these ladies or men. Pathologists, these are doctors that work in the lab and decide what bacteria is infecting you when they get your blood tests. Anesthesiologists, these are doctors that administer medication to you to put you to sleep during the surgical process. And then hospitalists, these are neat. So they're like general family doctors, right? But they work only in the hospital and they only see patients that are inpatient in the hospital. So if you go to the hospital, okay, so let's say Dr. Smith is your doctor, your normal family doctor, but you get admitted to the hospital for dehydration and septicemia. You're not going to see your family doctor while you're in the hospital anymore. It used to be like that, but it's not now. You're going to see Dr. Schwartz, who is a hospital licensed and owned physician that only works at that hospital. And then Dr. Schwartz sees all of the patients that are on that floor that day, okay? And then they have a rotation of different physicians in and out, daytime and nighttime, okay? So it's like an inpatient family doctor, kind of. But you do need to be aware of the difference between these four types of physicians. Like, this is important. Okay, cool. All right, types of professionals in healthcare. This is also another really important slide. So if you are into taking notes, I would maybe highlight this section. So an ARNP is an advanced registered nurse practitioner, okay? These are your nurse practitioners that have additional education. Oftentimes you could hear them referred to as certified nurse practitioners, but the advanced registered nurse practitioner is an RN that gets their BSN that then goes to school for additional time to become a nurse practitioner. A PA is a physician's assistant. Nurse practitioners and physician's assistants can do a lot of things on their own, but they also, for some things, have to be directly supervised by a licensed physician. A nutritionist is a dietitian, basically. It's a person that goes to school to learn how the body processes food, and it's a lot of chemistry, it's a lot of science, but these people help patients that need special diets due to whether it be Crohn's disease, diabetes, all sorts of different things that can impact how your body processes different types of food. An RN is a registered nurse. A lot of you have vocalized that you want to be a registered nurse, and I ask you to keep your eyes and mind open because there are so many more jobs in healthcare than just nursing. Now, another cool thing about nursing is that it's also very expansive as a whole, which means you can become an RN and then you can work in all kinds of different facets. You can work for an insurance company and process insurance claims as an RN. You can teach. You can work in OB. You can work in the emergency room. Like, just keep your eyes open because there's a lot of different opportunity in healthcare as a whole. Yes, Jocelyn.
Are these like in the list of like which is better? Like
No, there's not a which is better. It depends on what you as the person are interested in. Like, if you, like Lenora, I'm going to use you. You want to work in endocrinology. That's important to you, right? That fascinates you. You want to know more. You want to help people in that field, right? Who said they wanted to be an obstetrician? Like an OB, an OBGYN? A pediatrician? Most of you want to be like peds doctors. Okay, so Phoenix wants to be in pediatrics, so that's what interests you. I have no interest in either of those things. I've worked in pediatrics. It is not for me. You know what I mean? My interest was more in like oncology. I liked stuff like that. It really just depends on where you want to go and how high you want to go up in the chain. So you can start as an RN working in oncology if that interests you. And then you can get your BSN, and then you can become a nurse practitioner. And then if you want to go even further, you can become a physician in that field. That's really it's really what you want to do. So it's individually specific. Yes. Yeah.
I want to be an anesthesiologist. Could I like start out like after this go to college for an RN? Like how would I get
You can, but there's specific paths that you would have to follow. So what you would have to do is find the school that you're interested in and see what their pathway to become a physician is. I have a student from a couple years ago who's actually in med school right now. She started the med school process the year she graduated because of her academic abilities. That's not always an option for everybody, but you know, yes, you can get your RN and then go to med school from there, but I recommend that you see what your other options are. Okay? All right. So, and then there's your licensed practical nurse. These are LPNs. This is kind of controversial, but these are sort of a thing of the past. LPNs are the step in between an RN and an MA. They're still going to school for it. They're still being hired. They don't make really much more than an MA does. And there's very few things they can do that MAs can't do. So just be aware of that. It's not... It is a nurse, yes, but they're specific to a certain field of nursing. Can you repeat that? That's not completely accurate. LPNs can work in a lot of facets, but most of the time they do work in nursing facilities, long-term care facilities, and they work more in direct care is the term that we use. Whereas medical assistants and RNs, yes, RNs can work in direct care as well. But medical assistants you're going to see doing a lot of different things, whereas I think LPNs are kind of limited to what they're allowed to do. Some hospitals don't even hire LPNs. They only hire MAs and RNs. So that's just something to be aware of. But there is a program where you can become an LPN and then just take a bridge class to your RN. So if that's something you wanted to do, you could do that too. And then there's your MA. So your MA is what we're learning to do. You can do all sorts of different things. There's really no requirement for specialty. You get trained by the physician that you work for if you want to learn something extra than what you've learned in school, or if the needs of the office or facility are extra. And then there's a phlebotomist. Just to be clear, a medical assistant can draw blood. We are phlebotomists as well as MAs. Like, it's all in one, okay? So if you take this program and you decide, I want to work as a phlebotomist, you can work as a phlebotomist as a medical assistant, okay? You don't need that additional certification to do that. But you cannot work as a phlebotomist with a certification in phlebotomy. You cannot work as a medical assistant without that certification. Does that make sense? Yes, no, maybe so? Okay, cool. Yes, Jocelyn.
So are you a physician? Like, since you teach us?
No, I'm a certified medical assistant. I do have some college education, but I'm certified through the state of Ohio. I'm licensed to teach. Like, I did go to school to teach, so I have that too. But no, I am not. I would not be a teacher if I was a physician. I'd make so much more